Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, the healthcare costs for retired British pensioners who return to the UK after Brexit could double to £1 billion if the reciprocal EU scheme ends. Without any new Brexit deal on healthcare, the Nuffield Trust says the NHS would have to foot the bill. They also warned that the NHS depends on EU workers, and any deal must prevent the serious problem of understaffing. Here's our health and social care correspondent, Victoria MacDonald.
At Kingston Hospital in Surrey, the man in charge of workforce and a European Union health worker. There are 400 EU citizens working here and about 400 with partners from the EU. Many of them currently feeling frustrated and fearful.
Our concerns are about the security and morale of our existing workforce, but equally we're worried about the future supply of staff, where we recruit specialists from, people who are in scarce supply, qualified nurses, occupational therapists. They're our concerns as an employer, and we feel we want to support the staff during this very uncertain time.
If they just agree to give...
Pascal Varley is a French dietitian married to a Brit. She says her colleagues worry about everything from training to pensions, even their mortgages.
Some colleagues have been here for 35 years, 25 years. If tomorrow they go back to Italy or Netherlands, or I go back to France after 15 years, we won't be entitled to any benefits. We've paid our taxes here. We don't exactly know what will happen to our pensions, to properties. So the problem is also with future on hold, basically.
And today the Nuffield Trust think tank highlights the impact on the NHS if the government does not secure a good deal soon. Today's report echoes what many in the NHS have been saying since, well, the morning after the referendum results, that there needs to be more certainty, more clarity, not just for the EU staff already here, but also for those who might want to come, and also for the Brits abroad. They want to know that they're not going to fall through some hole in a Brexit net. 190,000 pensioners currently live in the EU with reciprocal healthcare rights. If they returned, it could cost the NHS an extra £1 billion a year, the Nuffield Trust said, twice the amount currently spent on their care abroad.
On those key issues, staffing and migration, the status of British pensioners living in Europe, and also regulation of medicines and other key supplies, we need to be sure that Brexit negotiations are taking the NHS interests into account.
There are those too who now pay locally for their healthcare and no longer have a right to NHS care. They worry that they will fall through a gap.
The most concerning thing is the massive degree of uncertainty and the lack of answers, which, when you approach the relevant authorities, not only in France but in the UK, nobody seems to be able to give you a definitive answer.
Labour and the Lib Dems say they would guarantee the rights of EU citizens ahead of negotiations. But the Prime Minister said today, as she has said before, there needs to be a reciprocal deal in place first. The Brexit negotiations start on June the 19th, so for the moment, EU staff working here and those Brits abroad will simply have to wait.